Karnataka's MMR to be reduced by more than 40% and aim to achieve global standards, says State's Minister of Health and Family Welfare at a conference organized by RVU and IIPA, Bengaluru, 27 September 2025. In an effort to address the state's maternal health issues, Indian Institute of Public Administration, Karnataka Regional Branch, in partnership with RV University's Center for Global Health and Development, hosted a one-day conference on reducing maternal mortality in Karnataka. It was held at MineRVa Auditorium, RV Center for Leadership Executive Education, Bengaluru. The conference discussed recent data from the sample registration system. Karnataka's maternal mortality ratio, MMR, of 68 per 100,000 live births stands out regionally. Neighbouring states report MMRs largely in the 30s with Telangana at 59. The panelists explored targeted solutions across taluka hospitals, community outreach, workforce strengthening, and data systems. The event brought together policymakers, public health experts, and medical professionals to deliberate on the causes behind Karnataka's high MMR and to chart an evidence-based roadmap for rapid improvement. Keynote addresses were delivered by Shri Dinesh Gundu Rao, Minister for Health and Family Welfare, and Dr. Sharna Prakash R. Patil, Minister for Medical Education and Skill Development.
This in 1957 in Bangalore. Initially, the chief secretaries of the state were the presidents of IIPA. But in 1990 or so, since they became more preoccupied with their official duties, then Sri S. Ramanathan took over as chairman, and he continued for nearly 30 years as chairman of the IIPA. So IIPA has, in Karnataka Regional Branch, is among the most active branches in the country. We seek to be a bridge between academicians, the administrators, and the public. Because usually each of these work in silos. The administrators, there are so many research findings, but administrators may not know about them. Government, you have, as Dr. Ranjini has said, you have initiated a number of programs, but if you ask an academician, she will only refer to some old textbook where some old projects, schemes are there. So they are also not aware about the recent initiatives of what government is doing in this thing. And the public also generally, in certain areas, we seek to provide to raise public awareness. So in this sense, we have been organizing a number of conferences, seminars, lectures on different subjects. So last 2 years ago, we organized a conference on COVID management in Karnataka. COVID management in Karnataka, where a number of officers and NGOs who had participated in COVID, they got together so that we have brought out a booklet on the lessons of COVID management for the future. So that booklet also we have given it to, handed it over to the department, so that is available. IIPA has signed MOUs with a number of 13 institutions. Today we have signed it with RV University, and RV University has made a name as the most prestigious university in Bangalore, in the private university in Bangalore, with a very deep sense of quality, with a focus on quality in education. And they have made a name for themselves, carved out a name for themselves, and they are, of course, the top ranked in the engineering sphere, and I am sure that they will soon become the top private university in Karnataka and among the top in the country. So this conference, I was earlier chairman of Karnataka Administrative Reforms Commission. So in that report, we had made a number of recommendations as chief secretary also, I used to review this MMR, maternal mortality rate. I used to ask officers, health department, as to why our MMR rate, Karnataka's MMR rate, we have the largest number of medical colleges in the country, we have the largest number of the doctors probably in the country per population, per 1 lakh population. We have a large network of nursing colleges, paramedical colleges, and a very good health department which has delivered a number of programs. But in spite of that, Karnataka's maternal mortality ratio is highest among all neighbouring states. The recent sample registration survey, sir, of 21-23, you are aware of that. In Karnataka, our ratio, MMR ratio, is 68 per lakh live births.
The RV Trust and the RV University. The RV Trust was started 85 years ago by a freedom fighter called Mr. Shivanand Sharma. With a humble beginning of 4 students, today the Trust has more than 27 institutions spanning across schools to dental health, postgraduate management education, and bachelors of engineering and masters of engineering, and a university which is the latest of the lot, which was started 4 years ago. The university today has a strength of about 6,500 people, which has 9 schools, and it's regarded as one of the best emerging universities in India. The Outlook magazine rated it as number 1 for this year's rankings. The RV institutions and the RV Trust is committed to the cause of education. It has touched the lives of 8 lakh people over 8 decades. And today, as we talk here today, we have more than 30,000 plus students studying from class 1 to engineering and dental sciences. We give a lot of scholarships for needy and dental children. Every year, the RV Trust gives anywhere between 10 to 15 crores for needy children from the underprivileged society. I thank once again the Karnataka chapter of IIPM for inviting me to say a few words.
It is indeed a very, very important occasion for us, especially for the School of Economics and Public Policy, because School of Economics was our first founding school of RV University. It started initially as School of Economics and Finance. Father of Dr. M.P. Sham, late M.K. Panduranga Shetty, was very keen when the thought of RV University was seeded. He was very keen that we should have, apart from other schools, a very independent School of Economics. He didn't want to put economics as a department as part of School of Liberal Arts, which many other universities have. As we moved along, and Dr. Pushkarni was one of the first hires I hired way back in 2021 during COVID times. All of us joined this place with masks on in the same campus. And then it evolved to become a School of Economics. I bifurcated the school from the School of Business to give it its own shape. And then as Ranjani joined us, we amalgamated the two aspects of economics and public policy because they go along very well together. So yes, it is one of the small niche schools we have. We also have large schools like business and computer science and others, but this is one of the most important schools, and it is the most important intellectual school in RV University. We've got highest number of publication from a limited number of faculty members we have, and the numbers are growing. Our students are publishing in various newspapers and journals. One student has published an award-winning book. They're also active in national and international levels in sports, so they're just not studying, but they're also doing a lot of other activities. The first debating society was set up by the first founding batch. I had only 5 students in the founding batch, and the number has now grown to almost 60. I'm very happy to tell you that all 5 students who graduated last year from our school have gone abroad to study Masters in Economics, Masters in Finance, Masters in Business in some of the top-rated universities, including Warwick, including London School of Economics, and one student has got a position in Institute of Foreign Trade, New Delhi itself. We are very, very active in collaboration, and one of the things we wanted our school to differentiate ourselves is to become politically agnostic and ideologically agnostic school so that we can invite everybody in to talk and debate and discuss. We are the only school which talks to IIM Bangalore, which is the only school which talks to BASE, we are the only school which talks to ISI, we are the only school which talks to ISEC, and we are the only school which talks to NALSA. None of these schools talk to each other. So we invite all of them, so our school has become a kind of a interesting adda where people come and debate, discuss, deliberate and collaborate together.
And our former Chief Secretary, Mr. Vijay Bhaskar, who is himself one of our finest bureaucrats that Karnataka has seen, who has done a wonderful job. I've seen him personally, both as an MLA and as a minister working, and his contribution has been immense. And all the other dignitaries on the dais and all dear friends who have come over here to be a part of this discussion and to contribute to this discussion, and all the students also who are part of this program. So thank you very much. And this is indeed one of the most important subjects, I would say, for the health department, because the maternal mortality that number gives a very good, clear indication of how the health system of that particular state or district is working. If all the systems are working well, then the maternal mortality should be down, and it should be at the minimum possible level. So more robust the system, better the MMR. MMR and IMR become a key indicator. More than IMR, I think MMR becomes a very key indicator of the way the health infrastructure of a particular region is. And like our Dr. Ranjini, she while presenting, she said that how Karnataka, though compared to Indian standards, we are better off, and we are doing better than other states in India. But when we compare ourselves to the south, which is comparatively in all indicators, whether it's economic, social, democratic, all these things, all indicators, we are definitely ahead of the rest of the country. And in this aspect, when we look at it, we see that Karnataka is behind. In some other aspects, we are better than the other states, but in this particular aspect, we are behind Kerala, Tamil Nadu, Telangana, and even Andhra also. So, and Maharashtra, of course, our western region. So this is something that is definitely caught our attention too. And we've been, looking at how we can, because this is a very, very important thing, because if a person is dying due to, giving childbirth, then if it could have been prevented, then that is a failure of our system. And every life saved is such an important, it's such an important thing, because a life saved is something which has a great impact, not only on the family, on the individual, and it's a very human angle to it. And how we can reduce this became a very important focal area for us. So sometime last year, when we were looking at this maternal death, so we decided to, though there is a program of auditing, but we gave it a more, serious look at it. And last year, I told my officers that to look at all the maternal deaths that have taken place last year, and what are the reasons for these deaths that have happened. So this detailed audit was done by our people, and they looked at from April 2024, April 1st, 2024 onwards, till I think when I gave this order, I think somewhere in December, so maybe till December, Jan, they did an audit of all the deaths, and any other death that was being reported was also being looked into as and when it happened. Why it happened, what was the failure, was there a system failure, institution failure, or was there any other health reason or something which was not identified properly. So we looked at it very deeply, and we came out with our own findings. And this year in the CM's budget speech, we made it a part of a program that Karnataka aims for, to have a mission for zero preventable maternal death. It is called any maternal death that could have been prevented, it should touch zero. So wherever the gaps are, we need to fill that gap. Certain places, the doctors were not available on time. Certain places, the ANC checkups had not been done. Certain places, they had not been advised properly. So by the time they could reach the hospital, they found the hospital, but then they had to be shifted to another hospital. So on the way, they passed away. Certain procedural lapses, certain lack of having, some sort of, drugs which are essential but were not present. So in our system, I was looking at only the public system, not at the private system, only the public, our government facilities. So then we came out with this program. And our aim is to have, though our number is 68, it's come down according to our own figures right now. It's around around 60 right now. So, and we started implementing this program. And I would like to say that since we started implementing this program, this year alone we have seen a 25% drop in maternal mortality in Karnataka. This year alone. From compared to last year's numbers, this year we have gone down and there's been a marked improvement. So we are looking at so many things. I think some of my officers will be coming later and we will be giving you information. So we are looking at various things, even like yesterday. One of the things that we did was every taluka hospital and our important community health centers and district hospitals, of course. But every taluka hospital, right now we had a system of having one gynecologist, one pediatrician and one anesthetist.